Now, the director of the All India Institute of Medical Sciences said something very intuitive, but what has grabbed headlines nationwide, that India will see a peak in June, maybe early July. Now, that's pretty obvious that there will be at some point in time a peak, but a lot of people would ordinarily assume that the worst is behind us, that somehow because we've been locked in, that we've been able to deal with the virus. That's clearly not what the government knows is going to happen next. I just showed you what the peak could look like if things stay the way they are, which is why it's so crucial, and I'll show that to you again, that we bring things under control, that we start reducing the rate of spread of the infection. Because if the rate of spread of the infection stays where it is, then by the 30th of May, we could be looking at more than 230,000 cases, and that is deeply problematic. Which is why it's important to try and reduce the number of cases, and what we cannot allow at all is for this yellow dotted line to come to fruition, which is that the rate of spread of daily cases actually goes up. That is simply not acceptable in a country like India. We have to bring it down, as has been the case in several countries, the US, the UK, China, Italy, Spain, now bringing it down. What will it take to ensure we don't end up with 2.5 lakh cases, that we're actually able to bring it down and contain that peak? I'll get into that very deep in just a moment. We'll have some top global epidemiologists joining us to try and make sense of where we are at. But I first want to show you what Dr. Randeep Guleria at the All India Institute of Medical Sciences, remember when he speaks, it's taken seriously because he runs the most premier government hospital. He's part of the Prime Minister's COVID task force. His inputs are taken seriously. He's understanding what's happening within government. He's talking about things peaking in June, which means between now, mid-May, to June, things could get bad. How bad? How do we ensure that things don't go out of hand? We'll deal with that. First, here's the story.
Coronavirus cases continue to rise in India. The total number of confirmed cases is now at 56,342 with 1,886 deaths and counting. A deep dive by India Today's Data Intelligence Unit has revealed that around 63% of all cases in India have been detected in the last 15 days. The curve is rising and experts warn that it will peak in the June-July period.
So it is likely that it may occur somewhere in June or July, looking at whatever the modeling data people have made. This is based on modeling predictions that a lot of modeling specialists have done. But this may change depending upon how things pan out over the next few weeks.
Delhi's COVID-19 panel chief has also warned of a spike in cases in the next 2 months. For 3 days in a row, the capital has recorded more than 400 plus cases each day. Delhi's Coronavirus Response Committee has projected 3 scenarios for the spike. Stage 1, when the capital will start reporting 100 cases in a day. Stage 2, with 500 cases a day. And Stage 3 with 1,000 cases or more that will be reported in a single day.
पिछले 24 घंटे में अगर हम देखें तो पाते हैं कि कंफर्म केसेस की संख्या में 3,390 केसेस का इंक्रीज नोट किया है, पर साथ ही 1,273 पेशेंट्स क्योर भी हुए हैं. इस तरीके से हम देखते हैं कि क्योर पेशेंट की संख्या में लगातार वृद्धि हो रही है, जो कि एक पॉजिटिव न्यूज़ है.
With relaxations in lockdown, a surge in coronavirus cases is virtually certain. The Niti Aayog had projected that India's coronavirus cases will see a drop by May the 16th. But if the rise in cases continues at the same rate as now, the target seems unreal. The biggest question now is India prepared for the peak in the COVID curve? Bureau Report, India Today.
So joining me at this time is Professor Srinath Reddy. He's the president of the Public Health Foundation of India. He's also a professor of epidemiology at the Harvard School of Public Health. Professor Bhramar Mukherjee joins me, a professor of epidemiology and chair of biostatistics at the School of Public Health at the University of Michigan. So welcome. I want to first go across to Professor Srinath Reddy, and I want to show you this data that really is driving this conversation. And remember, I have extended this curve in a very, very simple linear basis, saying that if things stay the way they are and we continue to grow at the rate at which things are growing, which is actually a low-level estimate, because as the lockdown opens, more and more people meet each other. We've seen what's happening at liquor vends. We've seen what's happening with people coming out in the streets. So the rate of growth of infection could actually go up. We're looking at 2,35,000 cases by the end of May alone. So now the question for you, Professor Reddy, is how do we stop this from happening? Now, we saw what Dr. Guleria at the All India Institute of Medical Sciences said. He's expecting a peak in June. What could that peak look like to you? To ensure the peak is as low as is possible, what do you think we need to do?
Firstly, I think we must distinguish between the number of cases that are being now discovered with increased testing, and whether the rise in cases is because we are testing much more. Certainly, we do need to reduce the number of new cases, there's no doubt about it. But if we are testing a lot more, we are bound to identify many more cases, and many of them will be asymptomatic or mild cases. And we are also seeing, for example, that in Punjab on April 30th, we had 4.1% of the cases tested turning out to be positive. On May 8th, it is 2.6%. In Haryana on April 30th, it was 1.3%. On May 8th, it is 0.5%. So the question is, are the number of new cases as a percentage of the tests being performed, are they rising or are they falling? But certainly we will also have to take into account the total number of cases, because if they are likely to have serious consequences, we should be worried. But at this point in time, it appears from estimations done by my own colleague, Dr. Girdhar Babu, that the RO is also decreasing. And therefore,
are not, according to you at this moment. The last time calculations were made, and I want to explain to our viewers so we don't get caught in medical jargon, R naught is the rate of spread from one person to another. So one infected person, on an average, how many more people is he infecting? The R naught earlier was estimated to be about 1.27. What are your numbers at this time? And this is crucial because the more people each person spreads the infection to, the faster the infection grows. Go ahead, sir.
So therefore, now the other thing is, we are actually, now if we compare ourselves with other countries, if you take deaths per million, because ultimately many people will get infected, there's no question about it. This virus is not going to go away. The big question to be answered is how many of them are going to be seriously affected in terms of serious acute pulmonary infection as well as deaths. Now, if you look at deaths per million...
No, first, let's not go ahead of where we are. Can you tell us what is the R naught at this moment? What are the number of people each person is infecting according to your estimates at the Public Health Foundation right now?
Okay. If you take the 14-day R naught from April 28th onwards, on April 24th, it was 2.13. Now it is 1.82. If you take the 8-day R naught, it has come down from 1.21 to 1.04.
So that's crucial because it shows that the number of people who are being infected by each infected person is coming down. But yes, remember that we've been in a massive lockdown. So the opportunity to spread the infection is also limited because everybody is basically home. But now that they go out and meet more people, the possibility of the rate of spread increasing goes up. So how do we, Professor Reddy, try and stop that? Like, what can we do to try and minimize it? Because as Arvind Kejriwal said, we now need to live with the virus. But how do we live so we can live and the virus doesn't kill us?
I fully agree with you. But we must also recognize that there are large number of asymptomatic people who might not have been tested, who may be still carrying the virus. That's the global experience now. Therefore, whether a person has been tested and found to be positive or not, or untested and still carrying the virus, we have to depend upon a continued protection triad of physical distancing, masks, and hand hygiene. Because we do not know who is actually carrying the virus or not in a free-moving society. And therefore, while some spread is going to be inevitable, we'll have to try and curtail the spread as much as possible from tested positives as well as from untested positives.
Okay, Bhramar Mukherjee, the AIMS director and the government haven't given any estimates of what the peak in India could look like. but we're a very populous country. The density of population is very high, the level of hygiene not very spectacular. What are you estimating at the University of Michigan? What could the Indian peak be looking like, and what can we do to try and keep the peak low?
Yes, thank you so much for having me. And we have been doing this modeling, and the India data and the phenomenon has been quite puzzling. So if you remember, when we released our first projections, it was on March 20th, and we projected that there will be about 100,000 to 1.3 million cases in India by May 15th. And that was without the lockdown. And so now with the extended lockdown, phase 3 of the lockdown, we still see growth in the number of cases. And that could be a pure artifact of the testing mechanism, that the tests have also increased, because that's the biggest confounding factor here, as Dr. Reddy mentioned. And so I completely agree with that. But still, I have to really reiterate that you have to respect the virus.
No, so let's deal with your model first, because when you put out models of an open country and with the lockdown it's actually lesser, then you get the kind of flack that opinion pollsters get, where people say इनको कुछ आता ही नहीं है, करते रहते हैं अपना कुछ कुछ, they think that they are very good biostatistics and they're spending a lot of time doing these fancy modulations and calculations, but at the end of it they're wrong. And a lot of epidemiologists, and I don't mean this with any disrespect, it's just a fact, whether it's the UK, whether it's the US, whether it's India, a lot of the models are proven to be completely wrong. So people, they trust the India Today, Access My India opinion and exit polls because we get it right, but ordinarily they say, these guys have no clue what they're talking about, the numbers mean nothing, they're just doing it to satisfy themselves. So how do you respond to that? Why do you say it's puzzling? What is puzzling to you, Raman?
So what I have actually written a lot about is the uncertainty. I'm glad that you asked me this hard question, because professors like hard questions. And so the statistical models are actually wrinkled with uncertainty. When everybody is projecting these numbers, they're not reporting a confidence interval or a credible interval with how wide this variation is. And as you're getting more and more granular level of data, the models are coming closer to the truth, but you have no idea in terms of how the intervention is going to pan out. And so the public has a strong role to play in public health. So you project in terms of, okay, this will be the effect of forecasting or an intervention, but you really do not know because you are doing the conjecturing. So according to our models, I looked at them this morning, so that's why we built an app so that the model updates every day.
No, so what is your model telling you at this time? When Randeep Guleria at AIIMS says that there will be a peak towards the end of June or early July, what's the kind of peak you're projecting?
So we also predicted a peak in July from very early onwards that we asked for with our projections. And of course, interventions can have different effects in flattening the curve. We already know that. But we are looking at, from July 1 projections, about 3 to 5 million cases on July 1, so from our models. But again, I would be very happy actually if projections are wrong. And I say this as a statistical modeler, that interventions work and people social distance, wear masks, and beat the model projections. Nobody would be happier.
So let's work on what you're saying. 3 to 5 million if things go as per your model. What's your baseline scenario? If people wear masks, they keep their hands clean, they follow hygiene, they maintain social distance, then that 3 million to 5 million number, what could we bring it down to?
Right. So the model is operating under the assumption that with the lockdown, that R0 actually came down quite a lot. And so we assume that it came down to 1.2, which has not happened yet. And we have measures of suppression and cautious return built into the model assumption. So I think we have to be really, really careful as we interpret the numbers from these models and use them. But they are, like, regardless of what the exact numbers are, the takeaway message is the same, that yes, this could be an artifact of testing, but you cannot really underestimate the virus, and you have to do the social distancing, the travel ban, wearing masks, contact tracing, test, trace, and treat. The triple T principles cannot be violated.
So test, trace, and treat. Professor Reddy, how are we doing on these 3 T's? Because we bought a lot of Chinese tests, they didn't work out, so rapid testing is now on hold. Treatment, we're doing well. Our facility is far from being overwhelmed, which is a strong thing. And as far as tracing is concerned, in India, tracing anything, whether it's a criminal case or somebody who's a suspected victim, we simply don't have the kind of ability through technology that a country like a China or a Taiwan or South Korea or Japan would.
Well, I think as far as testing is concerned, numbers have gone up quite a lot, and many of them are being traced and isolated as well, the contacts. But let's look at some of the positive features. I certainly agree with Brahma that we do need to take a cautionary step and keep all these measures in full flow. However, firstly, we have 261 districts which have not reported any case so far, and 153 of these additional districts have not reported any case in the last 7 days. But more importantly, I'd like to go down to what I would say as the important element. How serious are these cases?
Correct.
Are they mostly mild or asymptomatic? Just look at the deaths per million. If we are very uncertain about models because of testing variations, there is one thing that we are certain about, that is deaths. Now look at the deaths per million. We have 1.3 deaths per million as of now. USA has 226 per million.
So that's also
UK
because they are
has
far
400.
further in the curve. That's because the infection has spread far deeper in their community, and therefore you can't compare. If the spread goes as much in our country as it has in the United States, those numbers could be manifold what's happened in the US, God forbid.
Unlikely because of the age structure. Very, very unlikely
Important.
because of the age
That's an
structure
important
and the
point.
higher rural population with less mobility. But that doesn't mean that we ought to be careless. We ought to take all the precautions as though the worst will come and then try and prevent it. But it's very likely that the age structure will be favorable to us. The high segment of rural population, which is not there in the US, UK, or elsewhere, is likely to be also better protected because of lesser mobility and lesser ingress of the virus. But all of these will depend upon how careful we are in following all these precautions when the lockdown lifts.
No, but while there was a lockdown, people were reasonably careful. After that, we've seen it, all the liquor vends, all form of social distancing being violated, people just next to each other, and there are also lakhs of migrants traveling back to their rural areas. Now, so far they were contained in the cities. As they go back, potentially, they could be carriers of infection. That's a problem that we have to consider very seriously.
Yes, they are being quarantined when they reach their villages. They are being tested as well if they are symptomatic. So the precautions are being taken. I'm not saying that we should take this lightly. But certainly from the point of view of the level of slowing down the spread, I think the lockdown has had its impact, and we ought to consolidate those gains as we move along further by not letting the guard down. And for that, we need to take all these measures.
And I want to build a very important fact for our viewers, and this should really be your key takeaway, if there's only one takeaway that you have. If you look at these numbers, you know, the numbers that Brahma is speaking about, 3 to 5 million, they sound very, very scary. But bear in mind that a majority of these cases are going to be mild versions. Many of the people, especially the relatively younger people, won't even find out that they had COVID-19. There's such a stigma that's built around the idea as if this is Ebola or MERS and it'll take you down, it'll kill you. It won't. Most people will just go on as if life were normal. We have to ensure they don't come in contact with the vulnerable, because that could prove fatal for the older people, those with comorbidities. But this is, we're going to have, people have to get used to, Brahma, in my view, to the idea that at some point in time, you may come in contact, you must try and stop it, but you could come in contact and you have to take the hit and you have to live with the virus.
So, yes, I completely agree with you. The whole world, not just India, is getting used to the new normal of pause, restart, and drive mode of living, learning, and leading. So I think that policymakers are also on an uncharted territory. We could endlessly argue whether the lockdown was effective or not, but the fact is you are not going to observe the counterfactual, what could have happened without the lockdown. And thank God that we are not observing that counterfactual. I have to say that the triple tree principles, which have worked in many countries, we have to really follow that. And there has to be a lot of community engagement and participation and buy-in that this is really important. Without generating panic, we have to be prudent and cautious and really transmit the right messages in terms of what we can expect. And I think that this is possible because contact tracing, maintaining contact diaries, and thinking about a safe workplace stop the prevent of the virus, but also pave the way to reactivate the workforce. That's also very critical.
Okay.
It's a very challenging problem, but we have to be vigilant. We cannot declare victory.
Oh, absolutely. And this is where I get really scared when people say, oh, we've done a fantastic job. Look at what's happening in the United States. Look at what's happening in the UK. Look at how fabulous India is. Don't jinx it. You cannot afford to lower your guard, because the moment you do, this virus doesn't understand the tricolor. It doesn't understand patriotism. It's a virus.
Nope.
It doesn't recognize national boundaries. We have to, as Srinath Reddy said, have our guard up all the way. I love data. Some of this epidemiological modeling is hit and miss at this moment. But as is the case with opinion polls, we are learning along the way. So Brahma Mukherjee and Srinath Reddy for joining us with your very sharp insights. It's important to know at least what the experts think about what that peak could be, and then see what can be done to try and reduce the peak or to prove the experts wrong. So that's really what we are working on. As Brahma said, she's very happy to be proven wrong if India does what it takes to ensure that the models go wrong. So thank you very much for joining me on the Newstrack tonight. I'm going to slip into a quick break. When I come back... Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.